everybody, this is Azar, physical therapist again. Today we're gonna continue talking about some thoracic spine exercises. We have been covering some stretches for scoliosis and for kyphosis of the thoracic spine, which is two postural issues that is very common in the thoracic. Now today we're gonna talk about general strengthening of thoracic spine. Although we said that thoracic is not too mobile and it's mostly stable by the rib cage and everything, all the skeletal part attached to it, but still can get weak also, especially around the shoulder blade, which we already talked about it in the shoulder part a little bit. So first exercise I'm going to show you in that part will be with the ball. You can use a ball or you can do it on the area that's a little bit, is like a bed or something that you can have a little altitude from the floor, so you can hang your body down and strengthen your thoracic spine. So thoracic starts from here, down on the seventh vertebra of the neck, goes to the L1, which is around here. When the rib cage finishes, down here, that's the thoracic area, and we're gonna try to strengthen that part. It's not gonna be easy, so you're gonna hang yourself a little bit from the ball or from some kind of bed or something. So first one is you're gonna do with the ball, try to go over there, and then you're gonna do this way. Try to really bring your upper back off the ball or off the surface. And go back down. Okay. That's going to be the first one. The second one can be happening on the ball also. You can go ahead and lie sideways on the ball or on the surface, and then go up like this. And as you can see, we are bringing our thoracic spine up, holding it for a little bit and relax. And you can also do it on the other side. This is different than the stretch on the ball, which I showed you last time. Okay? You have to make sure you can balance yourself a little bit on the ball. That's challenging. Okay? So, last one. You can lay like that on the ball. And then it's going to be like a half sit-up. Not the full sit-up, just the half. Okay? You just strengthen all the thoracic spine muscle. Easy. You can be on top of a bed again. Try to hang your upper body down and bring it up from different directions. That's going to strengthen the thoracic spine really good. The next one is going to be the shoulder blade strengthening, which, as we said, is overlapping the shoulder part a little bit. So the way that we do it in here, we can still use the ball or some kind of surface. This time you really don't have to be the whole body up, just your hand. We already talked about this. You probably remember that. Lower trapezius, middle trapezius, rhomboid. You can go all the way up. That's going to be your paraspinal muscles mostly. So this way, this way, this way, and this way. And you can also do this to strengthen some posterior deltoid, which is mostly for the shoulder. But as we said, shoulders overlapping a little bit with the thoracic spine exercises. So these were some strengthening of the thoracic spine that you can do it. Again, is not really unstable in the thoracic spine. Sometimes you don't need it, but most of the time, especially for people that have a scoliosis, which we already talked about it last time, they might need it. This can happen on the floor too, especially for the kids. You can do it on the floor. I can show you right there. So you can go ahead and lay down. And then with the leg and hand, everything gets off the floor. We call that airplane exercise. So we like an aeroplane. Okay, we can go up, bring it up, and we call that what? Superman exercise. The kids would love that terms because they might have been seeing the Superman, how it goes all the way up, and that would be a good terminology for the kids to use. These were some strengthening of the thoracic spine, easy, effective, especially for people with scoliosis. Sometimes we need to do one-sided. For some people with scoliosis, which are, as we talked about last time, they are like this. So what we need to do, this part's really getting tight, so we need to stretch that part, and this side is gonna get really overstretched. So which part is the strengthening? This side. So any part of the body that gets overstretched is getting weak. So we need to strengthen that side. Any side that gets a lot of pressure or shortened, that's too tight. So we need to stretch that part. We usually have to balance the muscle in the body. That's the most important thing that we should obey as a rule in physical therapy, trying to balance the muscles, meaning the muscle that are overstretched needs to be strengthened, that muscle are weak have to be strengthened, and the muscle are really tight needs to be stretched out. So if we can really make that balance happen, we can successfully treat a lot of problems in physical therapy, and especially scoliosis, because we can see exactly one side's overstretched, one side is over tight, so we have to really pay attention to figure out which side is which, and we go from there. So I showed you some strengthening exercises today, you can use them, and I showed you some stretching exercises in the previous video, and you can use that also. So basically, mostly for scoliosis, but also for the people with kyphosis, they can benefit from strengthening the upper back a lot. Because as you see, when we have kyphosis like this, we are overstretched on this muscle, and we need to really extend our body somehow, either with the ball or on the floor. So again, for kyphosis and scoliosis also, you can use these exercises for strengthening based on what your physical therapist diagnosed, and make sure again you don't have any contraindication to do them, everything is good, and if it's so, you can go ahead and follow these exercises and do it with me. Thank you for watching, and have a great day.